Okay then, so welcome to this evening session today, guys, which is all about preparing for the GPhC assessment and a key focus on time management. My name is Atif Sadiq. I'm the head of education here at Pharmacy Foundations, and hopefully from now until 9 p.m, there's going to be lots that we go through in relation to what you guys can and should be doing when it comes to the registration assessment preparation. So just so you are aware, the way the session is going to run then is hopefully throughout the session, you guys are going to engage lots and lots through the chat functionality, because that's going to be the main way of communicating with myself. Any questions, any queries, throw them into the chat. And obviously, if I need you to come onto the microphone, I will let you know. Everybody's at a different level, so, be mindful and be respectful of each other's opinions, thoughts, questions, and queries. And the key thing is, it's only an hour long, so hopefully I can keep you engaged for an hour. I know you must have had a mad busy day. I've had a lot going on today as well. But if we can focus for this hour, trust me, it's going to really be worth your while. So hopefully you're going to get a lot out of this. Okay then, so a little bit of background on Pharmacy Foundations. I'm not going to dwell on this too much. I think a lot of you already know who we are and what we do. So we're an independent training company focusing on the training and development of pharmacy professional at all stages. So you will have come across us, through social media and through a variety of these initiatives that are listed on the slide there. Over the last few years, there's lots of, additional what I like to call funky things that we're doing, so on campus, online, etc., and you can see that there as well. We are on social media, so I think a lot of you will know that our Instagram posts and stories are usually quite useful, very useful, like I say, for bite-sized learning. So do make sure you give us a follow if you are on any of these social media platforms. And we are also on Telegram, so a lot of the updates we tend to pop into there. In the future, hopefully, we're going to start doing some polls and mini mock exam questions on the WhatsApp group. So do make sure you join our WhatsApp group. So Pharmacy Foundations are the team. We're a team of pharmacists dotted up and down the country, working in a variety of different areas: hospital, general practice, community pharmacy, academia. And as I mentioned before, my name is Atif Sadiq, and here at Pharmacy Foundations, I am the head of education and one of the co-founders. But before I do dive into the session itself, I just thought it'd be worthwhile, particularly for those of you who haven't met me before, for you to hear from me a little bit as to why I feel I'm qualified enough to have this discussion with you today about registration assessment preparation, and more importantly, about time management. So I qualified as a pharmacist in 2014. And ever since qualifying, I've always had a keen interest in foundation training or pre-reg training. So over the years, I've held roles as educational program director for an independent community pharmacy chain, key focus pre-reg or foundation training. Currently, I work as the training program director for trainee pharmacists in Yorkshire and Humber with Health Education England. And in addition to that, I'm working at the University of Bradford as an assistant professor in primary care pharmacy practice. I'm also the chair for the RPS Early Careers Advisory Group. And in addition to that, I work as an advanced clinical practitioner. So that might give you a lot of information or background as to what I do from a pharmacist perspective. But remember, one of the key focuses for today's session is also time management. Is also a matter of how you kind of get over the procrastination, you're juggling things, etc. And as you can imagine, I've just told you I've got like 5, 6, even I've lost count of different jobs. So I'm going to try and share with you what I do in order to make sure that I'm keeping my head above the water. There's lots and lots and lots that I've learned over the years. So I'm going to try and share that with you as well. And if we do get the opportunity, I'm going to try and do a tailored, bespoke one-to-one discussion with one of you on the call today, so that everybody else gets a very good idea as to how they should go about, managing and balancing the expectations of this very busy foundation training year. So without further ado then, let's go ahead and talk a little bit about a story that I have for you all. And here it goes. So, once upon a time, I had an exam to sit. And this exam was going to be the biggest, absolutely biggest exam of my life. And as you guys have guessed already, this was the GPhC, the registration assessment to become a pharmacist. So this was back in 2014. And during this time then, the kind of things that I felt, and the kind of things that I went through, I'm going to try and share them with you because I'm pretty certain a lot of you will be going through something similar. So I guess initially, the first thing that I did in that foundation training year is lots of on and off revision. I'd open up the BNF, GI chapter, read 3 or 4 pages, get bored, stop, start again, stop, start again, get really demoralized. And it got to a stage where I had no idea what I was doing. I didn't know where I was coming and going. I thought to myself, there's so much to learn. So-and-so knows a lot more than me. What am I supposed to be doing? I didn't know, where I needed to start, what direction I needed to take. Super, super, super stressed out in relation to all what was coming up. So I guess with that, and I'm guessing a lot of you can relate with this, I'm hoping, I'm kind of striking code with you here because a lot of trainee pharmacists will be in a similar position. Hands up if you are in this position, or a comment in the chat if you are, because I don't want to just be talking at a screen. I could have been quite easily watching Man United play right now. I've taken my time out this evening to have a chat with you all, but hands up if you're feeling like this right now. In order for me to give you the most that I can, are you guys feeling like this? Yeah, some of the comments coming through in the chat, a few hands raised. And what I will say to you is, in relation to all of this, the absolute biggest piece of advice that I got, or I guess not even advice, one of the key things that really was like a lightning bolt for me was one of my lecturers at uni sat me down and said to me, Atif, how on earth can you prepare for an exam of this, I guess, size, magnitude, etc.? How on earth can you prepare for an exam if you're not 100% sure on what it's actually testing? Because, like I said before, what I was doing was I was basically all over the place. As you can see there, I was starting, stopping, doing a bit of calcs, doing a bit of OTC, a bit of law and ethics, a bit of the BNF, stop, start, not knowing where to go. And this question really struck a chord with me. And what I was advised to do was to have a look at the registration assessment framework. And I know some of you might have come across this before, either on a session with me in the past, or just generally you might have had a look at it. But basically, what I was told by this academic member of staff was, you need to have a look at the syllabus. You can't just go in and think, oh, I'll just revise like I revised for my last year at uni. Because what you've got to remember, when you're at uni, the exams are written to a slight different standard. You have OSCEs, you have your dispensing exams in some schools of pharmacy, you have a variety of other things like your dissertation going on. So it's not the same thing. And to be fair, I'll be honest with you, some of the university exams are a lot more complex and complicated in terms of the knowledge they require compared to the registration assessment framework. So like I say, the biggest piece of advice that I got was look at the syllabus, look at the registration assessment framework. And that's what I'm going to briefly go through with you in a few moments. But the other thing that I'd like to highlight as well is that when it comes to preparing for an exam of this nature, there's lots that you can do in terms of getting yourself in a position where you're being efficient, where you are being productive. So a lot of that's going to come in a few moments as well. But like I said, this was one of the biggest pieces of advice that I could get. Now, somebody's asked for the link for the registration assessment framework. I'll pop that into the chat later, or you can just bob on to Google GPhC registration assessment framework and it should come up. But let me give you a bit of a whistle-stop tour, because you're preparing for an exam. You need to know what is expected from you. And here it is. So first and foremost, hopefully everything on this slide here is probably imprinted within your brains, because none of this should be new. So first and foremost, you've got this exam at the end of the year, known as the registration assessment. And this will take place on one specific day. Yeah, so you'll have a day, you'll have 2 exams on that day. Ignore the third bit. I know I've wrote there that there are 3 attempts max, but that's only if you fail. And hopefully, none of you guys on the call today are going to fail the exam. So 1 day, 2 assessments. Yes, obviously, if you do fail, you have 2 more goes, but you guys have logged onto this call and it's what, January, so we've got more than enough time to make sure that you guys go out there and smash that exam. So generally speaking, with the registration assessment, you have 2 annual assessments, and summer assessment usually takes place in June. Autumn/winter assessment usually takes place in November. So I guess just so that we are aware of what you need to do in order to prepare for the exam and how much pressure you need to put on yourselves, can I just get you guys to put into the chat, what are you aiming for? Are you aiming for the June exam, or are you guys aiming for November? And we might have a mixed bag of people on the call for a variety of reasons, but do put that into the chat. And whilst you're putting that into the chat, for those of you who are from the University of Bradford, the session today is going to be slightly different to what we covered. So there are certain overlaps, but it will be slightly different, just so you are aware. So it seems like majority of you are going for the June exam. So that means pressure is a lot higher than those of you who are going for the November exam. And right now, you know, you're right to be on this call, because revision should technically, or even not even revision, preparation should start right now. So anyway, you've got this 1 day, 2 exams. And obviously, these exams can either take place in summer or autumn. Most of you, it seems like, in the summer. The exam format is fairly straightforward. You have 2 papers, 1 paper in the morning, which is all about calculations, 1 paper in the afternoon, which is all to do with MCQs and EMQs. And in relation to the actual exam itself, it takes place in test centers, a little bit similar to when you've done your oral exam. Or if you've done your driving test, your theory test, sorry, then yeah, similar to that. Not like the driving test on the road, because you won't be doing this on the road, don't worry. Pass mark varies from year to year, and 70% roughly is what is required to pass, but that can go up and down. So that's basically the end goal. The end aim is to get to this exam day, smash the exam out. And a lot of the time, students will ask the question, well, what on earth is coming up on the exam? What do I do? How do I prepare? How do I know that I have covered all bases? Well, initially, if you look at it from, I guess, a zoomed out perspective or a zoomed out lens, then what is going to come up on your exam is the following. It's going to be a combination of your undergraduate syllabus, the learning outcomes that you're working towards, and the registration assessment framework. So it's a combination of these, but having this here on the slide only gives you, I guess, a very, 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 very vague snapshot of what's coming up on the exam. But nevertheless, this is what the GPhC are expecting. They're expecting you to pick up professional ethics, etc., from your learning outcomes, the skills that you do day to day on your training site, the registration assessment framework, we're going to talk about in a few moments, and the undergraduate syllabus. They're not expecting you to remember the chemical structure for things like penicillin, but nevertheless, there'll be certain things that you've covered there, like OSCE, learning from OSCEs, as well as things like preparation. So for example, you might have covered first pass metabolism. So although they want you to regurgitate what is first pass metabolism, they'd expect you to know what that might mean for certain drugs like GTN sublingual versus GTN oral, etc. So these are the kind of things, generally speaking. So if you're wanting to, have a look to see what's further on in relation to the registration assessment framework. The link is there. I will post it into the chat later on. But generally speaking, this is what it looks like. But if we were to look at the registration assessment framework in more detail, then like I've mentioned before, the registration assessment framework is the syllabus for the GPhC exam, and it links in to a few key areas, which I'm going to bring up on your screens now. So first and foremost, it links in with your undergrad foundation degree and a few other learning outcomes that, to be fair, I don't think you need to overly worry about. This is more so for universities to be aware of. They're known as the future pharmacist learning outcomes. So by the end, what this means here is by the time you've done your undergraduate degree and by the time you've done your foundation training year, you will be in a position of expectation. You'll be expected to work as a pharmacist in the current climate, is what this second bullet point is trying to say. But nevertheless, the registration assessment framework has 6 key areas, and these are as follows. So you've got the registration assessment outcomes, therapeutic areas, high-risk drugs, pediatrics, calculations, and resource paths. So in relation to this then, the registration assessment outcomes, the first bullet point that you can see there, essentially is a table of weightings. So what the GPhC have done, they've been very kind to you guys, is that they've not only listed what the different areas are, they've actually told you how likely a specific area is to come up on the exam. So with the weightings, the GPhC have said that wherever, and this is hopefully the opportunity for you after this session, do make sure you look at the registration assessment framework. But what the GPhC are saying, wherever they use the term high or high weighted, then 60 to 70% of the questions will fall within this category. So for example, and I'll come on to this on the next slide, the CNS chapter is high weighted, as is the cardiovascular chapter, as is the infections chapter, as is one of the other chapters, which is, the endocrine chapter. So basically with these chapters, 60 to 70% of questions will be coming from these chapters, particularly for paper 2. So I've given you a rough idea of what that means per question for paper 2, the EMQ MCQ paper. So you got high, medium, and low. So they've been very kind to break this down for you all in this terminology. So it makes it a little bit more easier for you. And then not only have they said high, medium, and low in terms of the general layout for the assessment, they've also kindly done that for each of the BNF chapters. So I'm going to let you have a look at that slide there and pause for a second, because the reason why we're on this call today is to help you guys prepare for the registration assessment, and also to allow you to be efficient, to allow you to plan ahead, to allow you to make sure you're using your time wisely. Now, if this slide over here is a bit of a revelation to you, if you weren't aware, then you know what your priority areas are. And if you were already aware that the likes of cardiovascular, CNS, infections, endocrine, etc. are high weighted, then technically you should be in a position whereby you are action planning. You're thinking, I've got X amount of months left. How do I make sure that I focus technically on everything, but especially on some of the high weighted areas? So anyway, like I say, the GPhC have been kind there. Remember, we're on this quest together, aren't we? We're trying to find out, well, what do I need to do? Remember that question that I had on that slide earlier? How can you prepare for an exam if you don't know what you are preparing for? So part of this, we're on that journey to find out. So hopefully that makes a little bit of sense there. Now, on top of the fact that these areas are high, the other thing that the GPhC have kindly done is provided you with a list of high-risk drugs. So what this means is, in addition to knowing what's high, medium, and low in terms of BNF chapters, the GPhC are guaranteeing that you will get at least one question on each of these areas. So antibiotics, anticoagulants, antihypertensives, chemotherapy, insulin, etc., etc., etc. And it ends down there at the bottom with valproate. So you're guaranteed at least one question. Now, I make that roughly 12 bullet points. So technically speaking, again, how can you revise for an exam if you don't know what is expected for you? If you know that you're definitely getting one question on this, then if I was action planning, if I was in your position as a trainee pharmacist, these drugs would be there as my key area of focus, because I'm guaranteed a question, and that's 12 marks. So do make sure you take a look at these. And there's a variety of ways as to how you might do this. Again, if I was in your position, I would probably create flashcards or posters or something similar to, for example, it says here, drugs with narrow therapeutic index. So here at Pharmacy Foundations, we've got, posters like these, for example, for cyclosporin. That is a drug of a narrow therapeutic index. Try to write down the key points. Go into the BNF, have a look at MHRA alerts, have a look at mode of action, have a look at key side effects. Because the question, for example, one of your 12 questions that says, will be on drugs with a narrow therapeutic index. One of them questions might literally be this: which of the following drugs need to be prescribed by brand name? And cyclosporin might be an option. See, so if you look at these drugs in detail, hopefully you'll be in a very good position. So far we've said the weightings, we've said the BNF chapters, we've said high-risk drugs. The other key areas, the three other key areas that you need to be familiar with for the exam. So pediatrics, so around 20% of the questions will come in the exam based on pediatric patients. What I normally advise for this is make sure you're reading the children's BNF alongside the adult BNF, but only really do that for areas that are non-specialist. So I'll say that again. Make sure you read the children's BNF alongside the adults BNF, but only focus on the areas that are non-specialist. So what I mean by this is, and this is something that I've used as an example in the past, conditions like hypertension, you're expected to manage them in adults. But what do you guys think, if you can on the chat, managing hypertension in a child, is that quite specialized, or is that something that we would expect everyone to be able to do? Because a lot of exam prep guys, it is common sense. So what do we think? Is it quite specialized if you're managing hypertension in a child? Exactly, it is specialized. The exam focuses on trying to get you guys to a stage whereby you're a competent day one pharmacist. So what I would say, again, coming back to pediatrics, if you read the children's BNF alongside the adults, and it's something like hypertension, which is specialized, you don't need to worry about that in the children's BNF. But as, for example, Jyoti's mentioned in the chat, antibiotics, chest infection, if you were, for example, going to manage a chest infection in an adult, would you need to manage that in a child if you're working in practice? I would say yes, because that's not a specialized area. So a lot of it, and I know there's another comment in the chat, what are examples of non-specialist areas? So an example would be chest infection. Another example would be indigestion. Another example would be hay fever, etc. Asthma is another example, because these are the kind of things that you see day in, day out in general practice in community pharmacy. So that's the key advice in relation to that. And then obviously you've got your calculations as well. So at least one calculation question which involves each of the following areas. So you'll definitely get at least one calculation in the following areas for part one. And part two, your MCQ paper, will also have some calculations. And I know you guys are already aware of that, the fact that there is a focus on calculations. And we'll talk a little bit more about how to prepare for calculations when we carry on with the session. The final aspect then of your exam is the fact that you'll be given a resource pack. So you'll be given a pack in the exam that links in with some of the questions. So 25% of each paper will link in with a pack. And the key thing that the GPhC are trying to test when they have resource pack questions is your ability to be able to use a resource quickly and accurately. So for example, you might have a 25-page SPC and the question So SPC, summary product characteristic. The question might be, which of the following is the rare side effect of this drug? Now, it'll be a drug that you won't know off the top of your head, so you have to look it up. So practice makes perfect with that. I think we will have a session coming up on resource packs later on in the year. So do make sure you're on the WhatsApp group, because in the past we ran that session for free. So do make sure you keep, on the WhatsApp group so you can attend that session as well. But generally speaking, that is the registration assessment framework in a nutshell. So like I was saying before, how can I prepare for an exam if I don't know what's coming up? But now, hopefully, for those of you who are still awake, you know what's coming up. You know what is expected from you. And I'm hoping that makes a lot of sense. So I'm going to just give that a massive green tick, and I'm going to just pause briefly to see if there are any questions about what's coming up in the exam, or if there aren't any questions, can I just get some sort of reaction from you to say that you know what's coming up in the exam, you're quite happy with roughly what is expected. And I've got some specific questions coming through, which is all good, but keep them chats or them comments coming through in the chat. Is it okay? Does it sound fine? Are you roughly following me okay? I know it's at the end of a long day, and if you can just bob that, and then hopefully we will move on. And I'll pause briefly as well. How do I revise interactions? There's a question in the chat. I can come to that later when we do our Q&A, if that's okay. And yeah, perfect. Okay then, okay, cool. So big tick. We know what's coming up on the exam. We're happy, we know what we are working towards. But the key problem, which I encountered once upon a time, like I was saying before, and I'm pretty certain it is something that a lot of you are victim to, is procrastination, is ineffective time management. But in addition to that, it's probably being super busy as well, and knowing how, when, where to juggle commitments, work, revision, family life, relaxing time, etc. So that's what we're going to focus on now, hopefully. And I'm going to try and give you first and foremost some of my favorite productivity techniques. Because the thing is, you know what you're working towards, and a lot of the times it's a matter of just sitting down and cracking on with it. But because this exam is almost 5.5 months away, you can't just completely, sit there for hours on end and, read, because it's going to burn you out. So you need to do it in a way that you are being productive, that you are being effective as well. So here are my productivity techniques. I'm going to go through them initially. After I've gone through them, I'll let you know what I think the learning structure for your year should be. And then after that, what we'll do is, hopefully, if we've got some time, in addition to the Q&A, we'll try and get one of you to jump onto the call and use the time wisely. I'll be able to try and give you some personalized advice in relation to that. So now that we know what we're preparing for, let's look at what you should try and incorporate into your day-to-day. And this is based on, I guess, my favorite productivity techniques. Because like I say, I've got lots of jobs. I've got like almost 6-7 different jobs. I lose count. So first and foremost, if you can, particularly on the weekends, start your day early. Now, I would probably argue that you do that during the week as well, because anything that you can get into a routine of, is easier to be in that routine on a weekend. Starting your day early will allow you, with that little bit of extra time in the morning, to be able to plan ahead, to be able to create the important to-do list, which everybody should try to be doing every single day, whether that's when they're at work or whether that's when they're trying to revise or prepare for the exam. So that's point number 2. So first, number 1 is start your day early. Start your day early. For example, I'll probably start my day usually at 5 a.m. I'm not saying all of you guys wake up at 5 a.m. It takes a bit of time to kind of get yourself to that, where you might want to I don't know, maybe wake up at 7 a.m. and then go back by 15 minutes and back by another 15 minutes, etc. But start your day early, because the kind of people that are awake when it is early morning are the kind of people that just want to crack on with stuff. There's no other distractions. For example, if you like me and you like watching footy, there's no football on at that time. Your friends, a lot of your friends, family members will be asleep. So starting early, you can create that to-do list. Now, when you create a to-do list, the benefit of creating a to-do list is it gives you purpose for the day. It provides you with direction for the day. Now, you might have a rough to-do list in your head. You think, oh yeah, tomorrow I'm going to do X, Y, Z. But if it's not written down, chances are you're going to miss out some key points. So I would say physically write a to-do list. Now, a lot of you guys might not like writing on paper. I tend to do it on Microsoft Word. Open up a new page, to-do list. What have I got to do today? If you do it the night before, even better, because mentally you're preparing yourself before you're going to sleep that I need to do X, Y, Z. Makes it a lot easier. So start your day early. If you can, one of the first things to do is create a to-do list, or try to do that the night before. Because the exam is so far away and because it is quite mentally draining, the other thing, very, very, very important, is make time for exercise. So you've been asleep all night. Your body is not going to have as much energy as it has in the morning. So a lot of this thing with regards to exercise, you guys are aware, you're on the call, you're trainee pharmacists, you've got the background. Obviously, exercise is good for your health, releases endorphins, makes you feel better. But one of the key problems, particularly when you're revising, or particularly when you've got a flexible schedule on a weekend, is that a lot of the times what we say is, well, I want to exercise, I am going to do some, and that could even be like a light walk around the block or whatever, but I'll do it after I've done my work. I don't know how many of you have done this before. I often used to do this, and I used to be always finding myself in a rut where I'd think, oh, I'll do it afterwards. When it came to afterwards, I'd carry on doing work. But because I hadn't exercised, I'd feel lazy, I'd feel bad about myself. It's all a mental game. This exam that you've got coming up, this massive exam that you've got coming up, it's a mental game. So tip number 3, make sure you are making time for exercise, preferably in the morning, because you've had that resting time. I know some of you got commitments in the morning, you might have childcare, etc. But nevertheless, try to fit that time in for the exercise. So now that you've started your day early, now that you've created a to-do list, now that you've done your exercise, by the way, the exercise should be on your to-do list. So it's not just a to-do list for the exam, it's a to-do list as in what do I need to do for the day. Then revisit your list after you've done your exercise and assign priorities to the tasks on your to-do list. So what do I mean by assign priorities to the tasks on your to-do list? So on your to-do list, you might have 5 tasks, 10 tasks. Let's just say you got 10 tasks, nice round number for argument's sake. You need to work in a way that if for whatever reason you are not able to complete the whole list, ideally your planning should allow you to, because you don't want to be overly ambitious. But nevertheless, let's just say if for whatever reason one task's taken longer than the other, or you just happen to finish early for whatever other reason, you need to prioritize what you want to do first, second, third, fourth, fifth, etc. So prioritize your to-do list. And a lot of the times people struggle with this part, because we've got a to-do list, it could be this long, and then we've got 3 hours of productivity. Let's just say on Saturday you want to work 9 a.m. till 12 p.m. It's not realistic that we can fit everything in. So you have to be realistic with your to-do list. But if you're still struggling, then the other thing that I usually have in the back of my mind are 3 key techniques to ensure that you're making the most of that to-do list and that you are getting through that to-do list. So these 3 techniques you might have come across before, but these 3 techniques I swear by. So I use these all the time. So 80-20 technique, anybody come across that before? And this might be a worthwhile time to see if anybody come across any of these techniques before. If you have, make yourselves heard. But I'll briefly go through these because these are really useful. And if you're saying yes, tell me what you've come across before. So if it is it yes that you've come across all three or one of them, feel free to unmute yourselves. So eat the frog, somebody's come across before. Eat the frog, fantastic. I'm hoping this might have been influenced by me, but I'm not saying I'm the instigator because it's a popular routine. Okay, fantastic. So some of you are familiar with some of these. Fantastic. So 80-20 technique. And my variation of 80-20 technique might be slightly different to others, but I think some of you have got the gist, generally speaking. But use this for your priority list. So let's just say you have got, and by the way, the three techniques that I've mentioned there, they're based on theories. So there will have been somebody clever who's come up with these, not me. And they would have said, this works because X, Y, Z. Yeah. This works because, you know, most people do X, Y, Z. So anyway, 80-20 technique is, let's just say you've got 10 things on your list. Now, what the 80-20 technique theory says that there will always be 20%. So if you're using the 10 items on the list as an example, so 2 items on that 10 item list will always be worth more, a lot more than all of the other 8 items combined. So 2 items on that list will always be worth a lot more than 8 of the items combined. So when you're doing your priorities, what you would do is you'd think to yourself, I've got all these 10 things to do, but which of these 2 things are the most important? So you'd pick out them 2 things and you'd focus on them and you'd bash them out, basically. So that's what the 80-20 technique roughly says. I bet you there is a very, I bet you there is a funny comment in the chat. I bet you there is a very useful video on YouTube that explains it a lot better. But generally speaking, that's what it is. So you create your list, 8 tasks, 2 tasks, then 2 tasks are the most important. Do them, get them out of the way. So that would be one way of doing assigning priorities. The other one is called Eat the Frog. Eat the Frog. This is one of my personal favorites. So apart from those of you who like eating a frog, or for those of you who have had frog before and you've enjoyed it, I think it's a delicacy. If you're from France or French cuisine, actually, it's a delicacy having a frog. But generally speaking, I think most of us will agree, if you want to pop it into the chat as well, if I asked you to eat a frog, would it be quite terrifying? This is a little bit like being on I'm a Celeb. If I asked you to eat a frog, let's just say, gunpoint, I said, you need to eat a frog. How would you feel? Let me know in the chat. Is it something that's going to be quite enjoyable? Is it going to be like, yeah, I'll do it. Give me the frog. I'll bash it out. What's the situation? In the chat, if you can, let me know how you would feel if I asked you to eat a frog. Depends on the frog, would give me the ick, I'll be scared, okay? So, and I think Tosif says, depends on the frog, so I'm guessing he thinks it's a chocolate frog. Not a chocolate frog, Tosif, a real frog. Right, okay. So I think most of us will be scared. I'd be scared. I would not want to do it. So what the Eat the Frog technique says is that if you have been given the task to eat a frog, you're going to hate it. You're going to absolutely hate it. A lot of us are going to absolutely hate it, and you're going to try and put it off. So let's just say I said to you, you need to eat the frog. By the end of today, you need to eat that frog. Atif, you need to eat it by the end of today. For the rest of that day, I'm going to put it off. But, you know, I might be out and about. I might be doing whatever. But in the back of my head, it's always going to be that I need to eat that frog. Oh, it's such a bad day today. It's not going well. Freaking hell, I'm going to have to eat that frog. Oh, no. And what that makes me then is really unproductive with all of my other tasks, because I'm thinking about that frog. I'm constantly thinking, I need to eat the frog. Now, what the technique says is when you have a list of priorities, you need to make one of them tasks. Do the most daunting task, the task that you're afraid of. For example, the CNS chapter, particularly maybe something like, I don't know, antipsychotics. I used to struggle with antipsychotics. Yeah. You're really afraid of that. what a lot of people tend to do is they put it off because they see it as a frog. They think, I don't want to do it right now. I'm afraid of it. I don't want to challenge it. Leave it, leave it, leave it. But the rest of their day will be unproductive because they're thinking about that frog. They're constantly thinking about it. But the theory says you should try and eat the frog straight away. Because once you've had the frog, once you've ate it, it's done. It's dusted. It's gone. You don't have to worry about it. So that's what that theory says is a daunting task. The frog, just get it out of the way. Because if you don't get it out of the way, you're going to be thinking about it all day. And you're going to feel bad. Any little work that you're going to do, you're going to think, oh, that's trivial. That's not, shouldn't be doing that. I still need to do my frog. So eat the frog. And the last one, and I think this one is probably, even though it's not necessarily always my favorite because I can't live up to it, I personally think this one's the most important for you guys. Because you've got so much to do, the one-touch rule is probably the most important for you guys. Because when you've created your list of to-do activities for the day, and I think a lot of you already do that, the one-touch rule says that once you've opened a task, once you've opened an email, once you said, okay, for today, I need to do 1 hour on OTC, 1 hour on calculations, 2 hours on CNS, blah, blah, blah. Once you've started that task, the one-touch rule says you don't close the task until you've finished it. You have to force yourself to finish it. Because what a lot of people do is they'll do a little bit of OTC for 5 minutes and say, oh, no, I don't want to do that now. Let's go into doing CNS. Oh, no, I don't want to do that now. And because they keep doing that over a few weeks, it feels like you've not accomplished anything. It feels like you've just done bits and bobs and you're still, it's a bit like my example. When I started revising, I used to do 2 pages of the GI chapter, close it. Then come back to it a few weeks later and then close it. And then again, and then eventually I thought to myself, oh, it's been 5 weeks, I've done nothing. So one-touch rule focuses on that. And the last thing, one of my favorite productivity techniques is this here, mini breaks, or what we also call this is the Pomodoro technique. You might have come across this before, you might not have. I started doing this because I started getting a lot of back pain. I used to be sat down all day doing my work, and I needed a way to kind of make sure that I felt energized as well as, being productive. So what I decided to do, and this is before I knew that this was a technique actually, was I thought, and the other thing actually was as well, I was getting a lot of distraction from my mobile phone. So what I would do is I'd sit down to do work, 9 o'clock. I'd do work for 10 minutes. 10 minutes into it, oh, somebody sent me a WhatsApp. All right, okay, let's see what's going on. Okay, and then I go back and it's 20 past 9. Then I work for 5 minutes, or let's see what's going on in Insta. And I just kind of lied to myself that I've been sat down for 3 hours and I've done 3 hours of work. What this Pomodoro technique tells us, and what this mini breaks that I tend to use tells us, is just like a tomato timer. You can get them timers, can't you? I think they're a bit dated now. Let's think of it as maybe a timer on your smartwatch or on your smartphone. Is you set yourself 25 minutes of productivity. So what you do is you sit down at 9 o'clock, for example, you put a timer on. During them 25 minutes, you do nothing but work. Nothing but work. You don't check your phone. You don't, But the thing is, with 25 minutes, it's such a golden, time period that it allows you to focus for 25 minutes. And then after that, you have a 5-minute break. Now, in that 5 minutes, if you want to go on Insta, if you want to go on Facebook or whatever, do whatever you want. If you want to go for a little walk, if you want to grab yourself a glass of water, do that. But 25 minutes, 5-minute break. 25 minutes, 5-minute break, etc., etc., etc. So these are my favorite productivity techniques. I don't know what you guys think about them. Any suggestions, comments, any questions, do let me know. But try to incorporate some of these, if not all, if you can. I incorporate all of them. And then this is just based on what I do, but you don't have to. These are just some suggestions there. Now that you know about what is expected from you for the exam, as in what's coming up, as well as some key productivity techniques, there's a few other things that I wanted to highlight to you all based on the foundation training year. So something a bit more specific. So my learning structure for the year recommendations are as follows. So obviously, when it comes to the learning structure for the year, you can't prepare for the exam without knowing what's coming up in the exam. That's one thing I've said time and time again. But in addition to that, you can't effectively prepare for something if you don't know what you already know. As in, what do I know? What don't I know? As in, what do I know? And what are the gaps? If you don't know what your gaps are, you can't, what are you learning? You're just regurgitating stuff. So the key thing, number one, is create a learning needs analysis. You need to create a separate one for your e-portfolio, because some of you are still doing that, rightly so. And you need to create a separate one for how you're going to do the exam. What I mean by this is literally exam day is, I don't know, whatever day in June, and I need to do X, Y, Z. I need to cover the following chapters. I've already covered these ones. I need to cover these ones. I've got this much time. Similarly with the e-portfolio, I've written this many evidences. I need to do this many, or I need to achieve that. You need to physically sit down and do this. This particular learning needs analysis or action planning is always overlooked by trainees. Guaranteed, there'll be lots of you on the call today that will be saying it's January this weekend. I'm going to, well, it's January, comma, this weekend, I'm going to smash revision. Yeah, I'm going to smash revision. And you're not going to even sit down to think about what you need to learn. You're going to just straight away do what I did and just start randomly reading the BNF. Doesn't work like that. You need to do a learning needs analysis. And obviously, what I've said before, reiterated down here, routine. Don't just go all guns blazing this Saturday, do a 18-hour revision, and then that's it for the rest of the 3-4 weeks coming up. You think, I've had enough. I've done my back in. I just can't do it anymore. Routine, little but often does it. Even if you did 3 hours this Saturday, 2 hours on Sunday, or you like to do it in the evenings after you come back, so long as it's often and it's little, perfect. Downtime and exercise needed, 100%. Yes, maybe closer to the exam, who knows? Maybe we like to really peak our revision, fair dues, but from now until at least May, you need downtime. You need exercise. I would argue you probably need it in June as well. But I know a lot of you guys will probably revise in a slightly different way, being, I guess, students or recent students. You will be revising in a way that's very unhealthy. But nevertheless, from now until then, downtime, important. And do make sure that you're being as proactive as you can when you are at your workplace. So these were my key suggestions. This is what you need to consider for the exam. I'm going to come on to Q&A in a few seconds. But now that you've all taken the time out this evening to join the session, is there anyone on the call that would like to spend 5 minutes on the call having a chat with me about what they want to achieve or where they are? Basically, we'll use the time to use you as an example, but also to create some specific action points for you. If anybody wants to put themselves forward, more than welcome to do so. If you do, you'll get a free MEP. That's the prize for today. A hard copy of the MEP through the post. How about that? If anybody wants to, go ahead. I think we've got Mike, maybe. Mike, are you there? Do you want to unmute yourself?
Hi, hello.
Hi, Mike. How are you?
I'm okay. Can you hear me?
Yes, I can. So, Mike, do you want to introduce yourself to the group? Let us know where you work.
Hi, I'm Mike, and I'm doing my placement at Lloyd's Pharmacy in the Manchester area.
Fantastic. So the way we're going to do this, Mike, then, this is just a way of showing everyone we're going to do a learning needs analysis for you. And hopefully that's going to be useful because it'll give you some points and tips. Obviously, you're going to get a free MEP as well now. But I'm going to share my screen so that I can show everyone what I would be doing when I'm doing a learning needs analysis. So, Mike, you're doing a full 12 months in community.
Yeah.
Perfect. So 12 months in community, that's fine. Perfect. So, Mike, what I'm going to say to you is, exam, when are you hoping to sit the exam?
June. So I think it's June 27th is the
So June 27th, yeah, 2023 is the end goal, or the day that you're going to sit the exam, yeah?
yeah.
Perfect. And when it comes to the exam, and this is for everyone on the call, we know that there are a few key areas, and these are as follows. So OTC, calculations, and law and ethics, and we've got, yeah, BNF chapters. Is that right, Mike?
Yeah, that's right. That's correct.
Perfect. So when you guys are doing your learning needs analysis, this is exactly what you would do. You might do it on a fancier notepad if you wanted to, but you just write this down, and then let's go ahead then, Mike. Mike, how confident are you with OTC? What have you done for it so far?
So for OTC, I've just broken down the topics into areas like the GI system, skin, childhood infections, and just trying to tackle. I aim for 5 a week, but around 3, I try and get. So I try to get about 3 topics done a week on OTC.
Okay. So have you got a list of them topics that you've already done somewhere saved, I'm guessing, or somewhere that you can refer back to?
Yeah, it's on my wall, so I can't avoid it.
Perfect. So has list already. So what topics are left to do for OTC then, Mike?
I say quite a lot. I couldn't tell you. It would take quite a while.
So that's perfect, because even though you're saying you can't say exact, it'll take quite a while. But if you were to quantify that in hours, roughly how many hours? Because you've already done some topics, so you'll know how much it takes per topic. But what we're thinking, ballpark figure?
15 to 20.
15 to 20 hours. Perfect. Cool. So what Mike has done here, guys, in the discussion that we've had, and what a lot of you guys will have been taught to do when you were doing your undergrad degree, is a SMART objective. So it's, in essence, we've got a few things. We can go into calculations, we can go into law and ethics and the BNF with Mike, but if we're just using the OTC as an example, we have got end goal June 27th. And I don't know how many weeks that's away from now. I'm presuming at least about 35-ish. I don't know. Anybody good with maths? Probably less than 35, actually. But let's just say it's 5 months away. 5 months away. And he only needs 15 to 20 hours. So, Mike, is that achievable before the 27th of June?
Yeah, definitely.
Perfect. What's it looking like in terms of prep? Do you do most of your preps on the weekend or the evenings?
Evenings after work, mostly.
And how many hours are you doing?
2 to 3.
So 2 to 3. Would you say them are 2 to 3 productive hours, or is it quite a lot of lagging?
I'd go for the lagging, like you said before. Yeah.
Yeah. And what about weekends? How many hours are you doing them?
Depends on the weekend, to be honest. I'd go for maybe it's less than 5.
Less than 5. Okay. Do you know when you're doing the 2 to 3 hours evenings after work, because you're lagging, realistically and honestly, how do they make you feel?
Demotivated, because you have to go to work again the next day, and then it's like a cycle, and then you're trying to break it. And do you get what I mean?
Yeah, no, definitely. Into them 2 to 3 hours, and this probably is one of the final questions. I know it sounds a bit like interrogation. Into them 2 to 3 hours, Mike, at what point did it feel like I'm just kind of doing it for the sake of it now?
About an hour and a half, an hour 45 after.
Yeah. Okay. Now, one thing I was saying to you, Mike, was that I've got experience of working with trainees, yeah, over many, many, many years. If I was to advise you, I would say, Mike, after work, just revise for an hour and a half.
Yeah.
And do that properly.
Mm-hmm.
Yeah. Maybe on the weekend, still do less than 5 hours, but trust me, mentally, it's going to get you to that level where you think hour and a half is nothing. I used to do 3 hours before.
Yeah.
And use them techniques, doing that 25 minutes, 5 minute off, 25 minutes, 5 minute off, or any of the other techniques that you mentioned. There's lots of other stuff that you can do from YouTube.
Yeah.
But I don't know, try and doing that. But look, your OTC, easy, 15 to 20 hours, we'll do that just like that. You can probably do that in a week.
Yeah.
Yeah, based on what you said. So 5 hours in a weekend, 1.5 hour. almost there, really. This time next week, you could, I'm going to say a Del Boy line, this time next week you can be a millionaire, but this time next week, you could have OTC boxed off.
Yeah.
And then calculation, similar thing. What have you done? What do you need to do? Quantify it in hours, guys. That's the key thing. We need to quantify things in hours. Mike, thank you ever so much. That's been very useful for me anyway, to use, I guess, your example to share with the rest of them. I don't know if that's been useful for yourself.
Yeah, very.
Yeah. So the key thing is all within your grasp, guys. It's not rocket science. The key thing is that learning needs analysis that you can see over here. It's worth its weight in gold. Yeah. This learning needs analysis. You can aimlessly open up a BNF and just go back, forth. It's not going to help. So any questions from anyone in the chat? We've got about 5 minutes or so. One question I'm going to read is from Sonia. How many evidences do we roughly need? This is dependent on what your designated supervisor wants. Some supervisors want 4 or 5, some want 2 or 3. If at this stage you don't know how many evidences you need, I'll be honest with you, you need to have that discussion with your supervisor ASAP. I tell trainees to have that discussion in the first month, because now you're battling and you're juggling with revising and evidences. But you never know. Your supervisor might say, I don't want to see many. I'm happy with the way you work. But nevertheless, you want that not necessarily written down, but you want it confirmed ASAP, Sonia. So I would say find out. It is all dependent on your designated supervisor. Please, could you clarify the detail we need to learn from the medium and low weighted topics? So medium and low weighted topics, rule of thumb, Samaya, is basically the kind of things that you see in practice day in, day out. I'll give you an example of the respiratory chapter. With respiratory chapter, you're not expected to know cystic fibrosis inside out, because that's specialized. But asthma, COPD, so it's the things that you see day in, day out. Now, I guess part of that question is also answered by some of the slides that are going to come up later, was that obviously you guys are aware, Pharmacy Foundations, we've got our own revision program, and all 6 key areas of the registration assessment framework is or are covered by the revision program. So if you want specific, as in what do you exactly need to cover, we will cover it on there. But generally speaking, what you've got to remember, guys, all training companies, and that includes us, we just kind of get the content from the BNF, we get the content from NICE guidelines, we put our creative spin on it, and we just compile it together and give it to you. So it's not that you guys don't have access to that information already. It's there. It's just that we do it in a nicer, neater way, so that you can jump on and maybe pick up some advice from myself or some of the speakers along the way. But genuinely, and this is, you know, me being upfront and honest, if you did what Mike and I were doing a bit ago, and you access the right kind of resources, there's nothing stopping you from, you know, developing your own little note set that's going to allow you to cover all bases. So hopefully that answers part of your question, Sumaya. I'm going to see if there are any other questions. I'll bring up this slide again, because this slide is very important in the background. Let's see what else we've got. What book would you recommend for learning over-the-counter topics? So this is something that we go into a lot of detail in that over-the-counter masterclass video, Karina. But basically what I always say is that with books, the day that a book is printed, it is already out of date. Yeah, because everything's electronic now. Everything's available. The guidelines are changing day in, day out. I personally would say that you've done your 4 years of undergrad. So technically, you only really use a book if you don't understand the concept of a condition. The books are good for that. So let's just say you want to understand how and why acne arises and what, you know, studies have said, etc. So you're thinking about the bare basics, then yeah, use a book. But to be fair, you've done that already as part of your undergrad. For the exam, the best resource or resources to use would be, number one, NICE CKS website, NICE Clinical Knowledge Summaries website. That tells you what to use, that tells you red flags, that tells you evidence-based medicine. Because a lot of the times these books will recommend wacky stuff like clove oil, use that for dental pain. Go onto the NICEKS website, it'll say there's no evidence. And you know what? In the exam, you are being tested on evidence-based medicine, not on wishy-washy, wacky remedies that you can use. It's what actually works. So NICEKS, Karina, NHS website, very good. And in addition to that, there are specific resources like DermNets, very good for skin conditions. Make sure you're looking at lighter tones, darker tones, because skin conditions manifest differently on a different shade of skin. So these are the kind of things that I would advise. You're on that WhatsApp group as well, guys. If you're struggling, these are the kind of questions that I want you to ask, because I'm that same person that bugs you on WhatsApp. I don't know if you've noticed, them comments that come through or the messages, they're coming from me. So just ask on there, and because like right now, you might not be able to think of all the questions, whack them onto WhatsApp. How do I advise interactions? I'm currently doing them on drug classes, but there are so many and I am not sure. The best thing that I can advise you, Jyoti, and this is something that a pharmacist once told me when I was doing my pre-reg. Whenever you're thinking about interactions, you don't need to regurgitate and memorize the BNF. All you need to do when you're at work, when you're doing case studies, when you're seeing any patient scenario, is group the drugs based on body system. Obviously, you know what resource to use. Use the appendix in the BNF for interactions, maybe Stockley's, but I would just stop at the BNF. Use the BNF appendix for interactions. But the way you do it is, let's just say you got a patient on atorvastatin, amlodipine, ramipril, sertraline. I'll say that again. Atorvastatin, ramipril, amlodipine, sertraline. I would class the drugs based on drug groups. So I would say atorvastatin, amlodipine, and ramipril, cardiovascular, sertraline, CNS. Now, first I'll do a comparison between the cardiovascular drugs. So is there an interaction between atorvastatin and amlodipine or ramipril? Well, atorvastatin is used to reduce cholesterol. That works in the liver. Amlodipine reduces blood pressure. Ramipril reduces blood pressure. They don't work in the liver. No interaction. Then amlodipine and ramipril, both of them reduce blood pressure. Is there an interaction? Yes, there is. But is it an interaction that we want? Yes, we do. Because there's no reason why we would put them on two drugs if the blood pressure was already controlled. And then you'd think to yourself, well, sertraline, does sertraline have any effects on the heart? And the way sertraline works, obviously you're aware, is increases serotonin in the brain. Has that got any relevance to renin-angiotensin system? Has that got any relevance to the liver when it comes to cholesterol production? And then basically, boom, that's how I would do it. So break it down, Jyoti, when you are doing that. You know what resources to use. I think it's more of a technique thing. So hopefully that helps answer that question. Okay, so I'm mindful we're slightly past 9. I do want to watch second half of football if I can, but I'm going to just round off with the last few points then. Obviously, you know what to do with the learning needs analysis. Do make sure if you're wanting to access these videos, go ahead and visit the website. But more importantly, if you want to make sure you are signed up to our social media platforms, then whenever anything like this, like today, comes up, then you're aware. Because I'm going to try and do some more of these. And the other thing that I was hoping to do was create one-to-one drop-in sessions, of course, freely available to you guys with myself if you ever have any questions. The WhatsApp group QR code is there. Like I say, hope you guys found this useful. Thank you ever so much for taking your time out this weekend. Not weekend, I do a lot of stuff on the weekends this evening. And yes, this session has been recorded. I am going to actually stop the recording now, but I hope you all have a great weekend, evening, and I shall see you all soon.